Wa alaikum salam wa rahmatullahi wa barakatuh. How are you?
I am fine. So, ladies and gentlemen, my audience, I am Dr. Zainab here again in Sunday Special with my special guest. I welcome Dr. Zainab Yunusa in my live session, and I will introduce my guest as she is a plastic surgeon by profession, and she's wellness fitness coach as well, and she belongs from Nigeria. And more detail of her introduction from start of her journey, from start of education, will be discussed by her herself. So I welcome you in my show. Thank you so much, Madam Zainab, for coming in my show, for giving me your precious time. I thank you from the core of my heart, and I will be happy that you share all your journey since from your childhood till your specialization and becoming a plastic surgeon in the country like Nigeria. Please share some insights to our audience.
Thank you so much for inviting me. I really appreciate the opportunity. Thank you, everybody, and it's good morning here in Nigeria. I am from Gombe, Northeast Nigeria. As introduced, I'm primarily a plastic surgeon. I work full time, but then on the side, I also work as the fitness, wellness, and well-being coach. Okay, so I was born, I've lived most of my life in the north of Nigeria. And if anybody has read anything about girl child education in Nigeria, you know that girl child education still has and a lot to do to progress in Nigeria. I don't know, one of the things that hit the news some years back was that we had this really terrible insurgency where over 200 girls were kidnapped from their school. Until date, not all of them have been rescued. So, girl child education is a big topic in northeast Nigeria. Okay, so I was born in a place called Kaduna, that's northwest Nigeria. My dad was a commissioner for health. My mom was a nurse, and they come from different parts of the country. And so I grew up with a mix of cultures, typical northern culture, and my mom is from the north central part of Nigeria. And so it was nice for me growing up, not realizing that what was normal for us was not exactly normal for everybody. My dad, my late dad, was Muslim. My mom is alive. She's Christian. And we had a mix of everything. And we saw it as normal. We didn't think it was anything. I had a very productive, very happy childhood. We lived together in peace. And then my mom, being a nurse, naturally drew me towards healthcare, set the tone for me going into healthcare. So for my elementary school, because my mom was a nurse in Nigeria military, so she was getting posted around the country, and we were moving with her. So I was about 3 when we moved, and then we moved to another town. I started school there. We were there for about 3 years, and then we moved back again to my birth city, Kaduna, because she decided she wanted a voluntary retirement. She didn't like all the transfers, the frequent transfers that she was having to go through. She wanted a more stable place for her children. Hence why we moved back, and she voluntarily retired from Nigeria Army. And of course, she retired from the nursing profession and went into business full time. And by the time she retired, I was just about getting into secondary school. But all along, I was already, I don't want to use the word indoctrinated, but I like to think that she actually wanted me to go into medicine. So, and then of all my siblings, it's my immediate older sister who went into something medical medicine related. She read vet medicine, so you can imagine that that was already drawing me into medicine. And then another older sister, after she finished her first degree, went back for medicine. So you can imagine that my journey was not totally unbiased. I had people that I kind of followed. So I got into medical school. I finished secondary school, uneventful, got into medical school. But sometime before I got into medical school, I had made up my mind I wanted to do medicine and I wanted to do surgery even before I got into medical school. But I wanted to do orthopedic surgery, not plastic surgery. But by the time I was starting, incidentally, my first posting as a clinical student, first year clinical student, was surgery. So I think that sealed my faith that I was definitely going to go into surgery. If you need me to slow down, do please let me know, and then I'll slow down. Okay. So surgery, and then when I went through orthopedics, I was still like, oh, that's where I want to go to. That's where I want to go to. Or as at the time I finished medical school, I still thought I was going to do orthopedic surgery. At that time, it was the same entry exam into surgery residency program for everybody who wants to do surgery, who wanted to do surgery then. So I got in, and there was some incident. You know how there's always some kind of political thing going on. I wasn't involved, but I had to go on leave just before I resumed my orthopedic surgery posting. And then one of my colleagues went to cover for me for like the 1 week before I came back from leave. And unfortunately for him, he got into some kind of political tangle between the trainers then, and he had to suffer it. And when I returned, the first thing he told me was, just remember to tell me when you're going on leave so I know to apply for my leave and I don't get into trouble for something you were supposed to do. When he told me the details, I was like, okay, I'm not sure I want to go into orthopedics anymore. And then when I did my plastic surgery junior residency rotation, I just fell in love with the consultants. They're very pleasant people. They want you to learn. They're they're not just about your academics. They want to know that you're all around happy. How is family? How is everything? And I think that sealed my faith in plastic surgery. So I went into plastic surgery, and my residency was uneventful. But somewhere, well, not but I got married like halfway through residency, had my baby, like first year of senior residency program, had my first baby. And my consultants were, it was as if their daughter was having a baby, the way they treated me. It was a fantastic program. I had very supportive colleagues, both the junior and senior ones, and my teachers. So I had, my residency was good. And then I finished residency and started work as a consultant plastic surgeon back in the Northeast. My training was in the Southwest of Nigeria. I got back to the Northeast, and practically, although I had a colleague who was there some time before me, but we practically built the specialty from start because there was no plastic surgeon in the institution at that time. So we started to build the specialty from start. And one of the things I really enjoyed was that my own teacher, my professor that taught me residency, the most senior of my trainers, he trained abroad. And when he got back, because he had very wide skills that covered a lot of specialties that went into urology and so many things. A lot of other consultants, when they got stuck, they, they had the tendency to push patients that they didn't know what to do to him. And he was doing them, but while we were training, he made sure to emphasize that don't take on what you know you cannot finish. And it was a very important lesson for me because by the time we started the plastic surgery specialty, there were only two other specialties that were established in the institution at that time. We had general surgery, we had orthopedic. The others were visiting consultants, so we didn't have a dedicated specialty outside general surgery, urology, after general surgery, orthopedics, and then plastic surgery. So there was a tendency for other specialties to send us just anything. So we had to establish the unit and then establish what we were not going to do. So initially, they were sending us such things as ingrown toenails. They were sending us such pathologies as necrotizing soft tissue infections, and it was a bit challenging to get them to realize that we can do this, but we don't do cases just because we can. We do cases that we know we want to do, and it is within our specialty. And luckily, most of those things have been resolved now. Occasionally, yes, we do have cases that will come. For example, in the last clinic, we had this young adult who has lipoma somewhere in the lateral chest wall, and she was really worried. She was very anxious about it because she's immunosuppressed. She's on antiretrovirals, and any small lesion on her body, she's scared it's a malignancy. So she was really worried, and telling her to go to clinic so that she could get booked for the general surgeons to see her was going to delay the time when the lesion was going to come out. So we just decided, yeah, it is general surgery, but it's something we can do. So we did that. So even though it's something that we have decided in the department that this is not plastic surgery, we still do a few cases like that just out of empathy for the patient. So now, as a plastic surgeon, I initially started in academia. I joined the local university. But after 1 year, I had to leave because the heat of the politics of academia was too much, and I didn't like the idea of the publish or perish thing. So I decided, you know what, I enjoy doing research. So I'm going to do it on my terms. If I decide I want to publish just 2, 3 papers a year because my promotion is not dependent on it, I'm really fine. So hence why I'm enjoying working with Author Aid, where we met. And I love working with Author Aid because one, you learn a lot as you're teaching others. And the gap, we're both from the global south, the research gap is so wide, not just in terms of output, but in terms of quality of research that is being done. And one of the core principles of Author Aid is quality research. You don't just teach research, you teach quality research so you can get quality output and hope to bridge the gap to some extent between the global north and the global south. I do a lot of talking, so I'll just stop here, except if you have another question for me.